Welcome to this episode of the Harpreet Singh Show. I'm your host Harpreet Singh from Surrey, British Columbia, Canada. In today's program, we'll talk to Alan Glasser, who's a well-known pharmacist. He runs Mark's Pharmacy in Delta, and he has been in this business for the past over 4 decades. So today we're going to talk to him in this situation of COVID-19 crisis. What do those people who have compromised immune system should know, and what all guidance would he like to give us today? So we'll be focusing on these aspects. If you have any question, you can send me directly on Facebook or YouTube as we are going live on that. And you can also text me at 604-603-7555. So let's start our discussion with Alan Glasser and ask him as to what all we should be careful during this pandemic crisis. Alan, welcome to the program.
Thanks very much, Harpreet.
Thank you. It's always a pleasure to be with you and learn from your wisdom. So today, take us on this journey as to how COVID-19 crisis is impacting, especially those people who have compromised immune system.
So let's take what we mean by a compromised immune system. That's a person, for example, who is taking medication that will suppress their body's immune system. Who can be some of these people are? If you don't even know it yourself, well, it's somebody who's taking medications like prednisone. That's an immune suppressant. It's people who've had a transplant, they're immune suppressed. It's people like who have diabetes, who already have an inflammatory situation in their body, and it can get worse with COVID. And I'll go into a little more detail later, especially with diabetes. So those are the kinds of people. People, if you got heart disease, people who have a lung disease problem, whether it's COPD or they got asthma, they are the people who are most at risk from this virus. And of course, anyone who's basically over 65, 70 years old, especially if you're over 80, you are definitely immune compromised. That means that your immune system is no longer able to handle the challenges of a new virus coming into your body. And that's unfortunately where most of the deaths have occurred in people over 80. I've heard, numbers as high as 82% of the population who dies eventually is over 80 years old. Mm-hmm. We know, the beauty is this though now, we know enough about this virus, we know how to prevent it. So what are the things we can do to prevent it? Well, the number one thing we can do to prevent it is you and I, when we go out in public, we need to wear a mask.
Right.
And up until we had the smoke, we didn't even have to wear the mask outside. Well, now with the smoke, they're even recommending we wear the mask outside to reduce the particulate matter that's in the air. When we go out of the house, you wear the mask in a public location, outside right now while we have the smoke, and in, of course, in a store if you're going shopping or visiting or whatever. Because you wearing the mask, the other individual wearing the mask is going to make a huge difference and reduce your risk of catching this virus. Now, of course, the second thing you need to do to avoid catching the virus is avoiding touching your face until you've washed your hands. That's why these soap and water works fantastic if you do it for at least 20, 30 seconds with soap and running water. Number two, of course, second choice is hand sanitizers and using that. Again, before you touch your face, before you touch food, and you start to eat. Then we know we've reduced your risk of transmission of the virus. So those are the easy things. Yes, they're worth repeating because just by doing these simple things, you can protect yourself. Mm-hmm. So, and it's really scary right now because I've had an experience in my own family, is that the kids went back to school. Actually, they went to preschool. For my niece, who, we've seen at a distance, with mask on in their backyard, so it was all safe. But we didn't realize that the children had no symptoms, mm-hmm. and one of their teachers had symptoms. And until they were notified that the symptoms, and then they could self-isolate, they were just, playing around with other children, with other families. You see how easy this thing can be spread. I know the grandparents of this family, they've been tested. Fortunately, right now they're negative, but, it's your grandchildren. How many times you want to pick them up and hug them?
Absolutely.
It's just a natural human thing to do.
Very
But
true.
we have to avoid that during this time.
Right. So, Alan, absolutely, you very rightly touched this aspect. Of course, earlier we knew that the elders are mostly having a compromised immune system, but right now, with no symptoms, people are talking about catching, their tests are coming positive or catching COVID. So, now the question is that when we talk about the compromised immune system, and especially people with diabetes or arthritis or other problems, so basically, when you say the compromised immune system, of course, these basic things of washing your hands or wearing a mask, they are important. But when it comes from the pharmacy point of view, please take us on this journey as to what all people who are suffering, already having diabetes or other compromised immune systems, what they should know.
So you need to understand, number one, if you have a compromised immune system, that means it's not going to respond in a normal manner. For example, someone who has arthritis or someone who has diabetes, and many, many people have arthritis or an inflammatory disease. Like if you have inflammatory bowel disease, any disease that's related to inflammation in the body, you're now at more risk. And why is that? Well, we know with COVID-19, when it gets into the lungs, you can have a problem in that you have an overwhelming inflammation in your lungs that literally makes you drown in liquids. It's just the cells are destroyed, they break open due to the inflammation, and they drown you with liquid. And that's why you need to go on a ventilator in the most severe cases, but that's not as successful. So if you can imagine, if your body already has some inflammation and COVID-19 comes in and triggers further inflammatory response by your body. If you can imagine yourself pushing a child in a swing, and the swing is you having inflammation in your body already, and it's just swinging a little bit. And COVID-19 comes along, and it's like you pushing your grandchild or child way too much so that it's swinging massively back and forth, and it looks like the swing will go over the top of the bars. That's what COVID-19 is doing to our body.
Okay,
our body's
great.
just overreacting.
Right. Thank you. We'll go for a short break, and from here only we'll continue with our discussion as to people who are already having a compromised immune system, what all they should know, and what precautions and what medicines which can be taken from Mark's Pharmacy, they can come and take your assistance. We'll talk about this after this short break. ਦਰਦ ਤੋਂ ਆਰਾਮ ਐਲੋਪੈਥਿਕ ਦਵਾਈਆਂ ਖਾਣ ਨਾਲ ਆ ਤਾਂ ਜਾਂਦਾ ਹੈ, ਪਰ ਇਸ ਦੇ ਸਾਈਡ ਇਫੈਕਟਸ ਵੀ ਹੁੰਦੇ ਹਨ। ਨੈਚੁਰਲ ਤਰੀਕੇ ਦੇ ਸਪਲੀਮੈਂਟਸ ਨਾਲ ਤੁਹਾਡੀ ਦਰਦ ਨੂੰ ਜੜੋਂ ਖਤਮ ਕਰਨ ਵਿੱਚ ਮਾਰਕਸ ਫਾਰਮੇਸੀ ਦੇ ਹਿੰਦੀ ਪੰਜਾਬੀ ਬੋਲਣ ਵਾਲੇ ਸਟਾਫ ਤੁਹਾਡੀ ਮਦਦ ਕਰ ਸਕਦੇ ਹਨ। ਇਹ ਆਪਣੇ ਪ੍ਰੋਡਕਟਸ ਕੈਨੇਡਾ ਦੇ ਹਰ ਹਿੱਸੇ ਵਿੱਚ ਵੀ ਭੇਜਦੇ ਹਨ। ਅਪਾਇੰਟਮੈਂਟ ਬੁੱਕ ਕਰਨ ਲਈ ਅੱਜ ਹੀ ਕਾਲ ਕਰੋ 604 596 1774 ਜਾਂ ਫਿਰ ਵਿਜ਼ਿਟ ਕਰੋ 8035 120 ਸਟਰੀਟ ਡੈਲਟਾ। ਦਰਦ ਨੂੰ ਜੜੋਂ ਖਤਮ ਕਰੋ।
Karen thought she won a gift card, but we had a much bigger surprise for her. We rise by lifting others. The Sant Motors.
ਕੀ ਤੁਸੀਂ ਸਰੀ, ਡੈਲਟਾ, ਰਿਚਮੰਡ, ਐਬਸਫੋਰਡ ਜਾਂ ਵੈਂਕੂਵਰ ਵਿੱਚ ਨਵਾਂ ਘਰ ਬਣਾਉਣ ਬਾਰੇ ਸੋਚ ਰਹੇ ਹੋ ਜਾਂ ਫਿਰ ਪੁਰਾਣੇ ਘਰ ਨੂੰ ਰੈਨੋਵੇਟ ਕਰਨਾ ਚਾਹੁੰਦੇ ਹੋ? ਤੁਹਾਨੂੰ ਲੋੜ ਹੈ ਇੱਕ ਤਜਰਬੇਕਾਰ ਬਿਲਡਰ, ਇੱਕ ਕ੍ਰੀਏਟਿਵ ਇੰਟੀਰੀਅਰ ਡਿਜ਼ਾਈਨਰ ਦੀ ਜੋ ਤੁਹਾਨੂੰ ਸਹੀ ਤਰ੍ਹਾਂ ਗਾਈਡ ਕਰ ਸਕਣ ਤੇ ਤੁਹਾਡੇ ਸੁਪਨੇ ਦੇ ਘਰ ਨੂੰ ਉਸਾਰ ਸਕਣ। ਅੱਜ ਹੀ ਕਾਲ ਕਰੋ ਹਰਪ੍ਰੀਤ ਜਾਂ ਸੰਦੀਪ 6048259295 ਉੱਤੇ।
Once again, welcome back to the program. Before we bring in Alan Glasser back, there are some questions which have been brought forward by our viewers, which I'll be asking Alan. And you are also most welcome to send me these questions if you have any through Facebook, YouTube, or on my cell phone at 604-603-7555. These programs have been brought to you with the support of some of our sponsors. Amongst those is Mark Pharmacy, and Alan is on the show today, who is telling us that people who have compromised immune system, what they ought to know. So this pharmacies is with a difference. Whereas you can get prescriptions, you also can get natural products, beauty products, hand sanitizers, and masks, especially during this COVID crisis. And they also run health programs on arthritis, cholesterol, diabetes, hypertension, nutrition, weight management. You can call Alan anytime at 604-596-1774. Address is Unit 101, 8035, 128th Street, Delta. Today's program has been brought to you with the support of Jas O'Brien, who is a well-known realtor in Surrey, Cloverdale and Fraser Valley area. He works with Remax Blueprint Realty, and he is known in the community for his integrity, commitment and results. So if you want to list your property or buy some property, you can call Jas O'Brien at 778-994-7450. His email is joe@jasobrai.ca and his website is jasobrai.ca. ਅੱਜ ਦਾ ਇਹ ਪ੍ਰੋਗਰਾਮ ਤੁਹਾਡੇ ਤੱਕ ਪਹੁੰਚਾਇਆ ਜਾ ਰਿਹਾ ਹੈ ਐਕਮੀ ਗਲਾਸ ਲਿਮਟਿਡ ਦੇ ਸਹਿਯੋਗ ਦੇ ਨਾਲ। ਜੇਕਰ ਤੁਸੀਂ ਆਪਣੇ ਘਰ ਨੂੰ ਇੱਕ ਨਵੀਂ ਤੇ ਵੱਖਰੀ ਦਿੱਖ ਦੇਣਾ ਚਾਹੁੰਦੇ ਹੋ ਤਾਂ ਫਿਰ ਤੁਸੀਂ ਐਕਮੀ ਗਲਾਸ ਲਿਮਟਿਡ ਨਾਲ ਸੰਪਰਕ ਕਰ ਸਕਦੇ ਹੋ। ਇਹ ਫਰੇਮਲੈਸ ਗਲਾਸ ਰੇਲਿੰਗਸ, ਕਸਟਮ ਵੁੱਡ ਕਲੋਜ਼ਟ, ਸ਼ਾਵਰ ਤੇ ਟਬ ਡੋਰਸ, ਸ਼ਾਵਰ ਸਲਾਈਡਰਸ, ਬੇਵਲਡ ਵੁੱਡ ਜਾਂ ਮੈਟਲ ਟ੍ਰਿਮ ਮਿਰਰਸ ਤੇ ਕਸਟਮ ਗਲਾਸ ਵਰਕ ਦੀ ਮਹਾਰਤ ਰੱਖਦੇ ਹਨ। ਵਾਜਬ ਕੀਮਤਾਂ, ਕੁਆਲਿਟੀ, ਕ੍ਰਾਫਟਸਮੈਨਸ਼ਿਪ ਤੇ ਹਾਈ ਕੁਆਲਿਟੀ ਲਈ ਇਹ ਜਾਣੇ ਜਾਂਦੇ ਹਨ। ਆਪਣੇ ਨਵੇਂ ਪ੍ਰੋਜੈਕਟ ਜਾਂ ਰੈਨੋਵੇਟ ਕਰਨ ਜਾ ਰਹੇ ਘਰ ਲਈ ਕਾਲ ਕਰੋ 604-543-8777 604 543 8777। So once again, let's get Alan back on air. So Alan, before the break, you were talking about, it becomes difficult for people who are already suffering that with COVID, it becomes a big issue. So during this time, what they ought to know and what all they should do?
Well, the first thing we want to do, everyone, you want to have a supportive immune system for your own body as possible. So that begs the question, how do you ensure you're at optimum nutrition? Because getting the best nutrition into your body is crucial to having all systems of your body work. And we actually run a test at Mark's Pharmacy. You saw it in that ad. It uses a beam of light. It takes 30 seconds. And from that, we can find out what your nutritional status is using antioxidants. And that's what we measure. So literally in the space of 30 seconds, we can see, is your body in the optimum range in terms of nutrition, minerals, vitamins, antioxidants, or not? If you're at all concerned. Is your body full of inflammation? Because we know already having inflammation is not good. We know inflammation's indicated in 70 different diseases. We want to make sure that you're at the lowest level of inflammation possible so that if you get COVID, you don't go on that swing and have that swing just go way out of sight and spin around the bar. That's how, inflammation gets out of hand. That's how you end up in, emerge in ICU. Mm-hmm. And unfortunately, a low percentage of people come out of there healthy. So you want to avoid those things. And it's just a little preventative nutrition. Make sure you're well nourished, and we can help you at Mark's Pharmacy, 80th and 120th Street in Delta. So the question was, what kind of supplements could help you?
Right.
So I'll go over 2 or 3 known supplements. Mm-hmm. Now the only problem with any of the bottles you see on the shelf in a pharmacy, in a grocery store, or wherever, in 2015, the Attorney General of New York State tested supplements in New York. And they found that 80% of the supplements that were on the shelves, and I guarantee you the same products come to Canada, they just got French and English on them, and an NPN. 80% of the products did not have what was on the label. Mm-hmm. Either they had, 80%, 90%, 50%, 0%. And the other scary part is 79% of the products that were tested had undisclosed fillers in them. Again, not on the label. Mm-hmm. So if you want to find good products that actually what's on the label is in the bottle, I'm able to test that. Okay. And I can test your own body to see where you're at.
Right. So this is a question which I've got, Alan, what you're talking. Gurpreet asked that how to increase the antioxidants in the body, because you said there's a beam of light by which you can come to know. But then how to make sure that the supplements that you are getting are of high quality? Could you please talk a little bit about that? And especially during this crisis, it's absolutely difficult for people to understand because everybody is in a crisis right now.
That's right. So we know that raising your antioxidants, and an antioxidant is, again, is a little atom full of electrons it can give one up and it doesn't search for it. That's what we call an antioxidant. The free radicals, that's what damages our cells and our bodies. That's another atom looking for an electron. If it takes it out of the inner workings of your cell, then you may have the cell not work right or you have cell death. So that's why it's a really important marker in our lives. So how do you tell it's a good high quality supplement? Well, you always test it. If you would go to your doctor and ask them to be tested, that'd probably cost several $100s. You can come to Mark's Pharmacy. So that's they do a blood test. So I have a device that uses that beam of light that's been tested in 84 different labs against blood tests, against testing for antioxidants that are also found at the back of your eye. And in 30 seconds and for less than $20, you can find out what your level is today. You can either make your choice of supplements that, antioxidants are something as simple as vitamin C, or, there's product on the market that say they're an antioxidant. I've tested people who've been on it, and the scary thing is they test like they have nothing in them. That they just ate veggies and a few veggies during the last couple of months, and there was no increase in their antioxidant level. I've seen this clinically, meaning I've had to deal with patients who were taking supplements that said on the label they're antioxidants, but when I measured it, I could not find it in their body. There was no change after 60 days. So it takes 60 days to make a change, and we can find it out really simple. So, Gurpreet, you're welcome to come to Mark's Pharmacy, 80th and 120th Street in Delta. We can do the test. If you can't make it, I can definitely recommend some supplements that normally I can measure.
Great.
But
Thank
I'll
you.
guarantee you'll raise it.
Alan, next question is from Greg, and he says that you have talked about the inflammation, and especially that is the reason for all the issues in the body. But how is COVID-19 further impacting the inflammation, and what can be done, especially to save yourselves from inflammation during this time?
Okay, so there's a number of, this is to do with drugs. So we now know if you are one of these people who are affected severely and that your lungs are involved, because that's the biggest thing. The other thing is clotting happens. So if you're already at risk, say if you're taking non-steroidal anti-inflammatories, okay, that's for people who have inflammation. They use ibuprofen, they use naproxen, they use ASA. These are all over the counter because they've got joint pain, muscle pain. That's all due to inflammation. But here's the other thing they notice is when you take those drugs, and you'll see right on the label, it increases your risk of strokes and heart attacks. Well, as it happens, so does COVID. So now you got two reasons that you could be increased risk of strokes and heart attacks, and that's really dangerous. So, if we're talking about reducing your risks, there's really one old prescription drug. It's called dexamethasone. It's been in the news. It's readily available, and the doctors would then have to make that decision when to give that to you if you ended up in hospital. I have other natural anti-inflammatories that's available off the shelf that you can try. I think did I answer Greg's question?
Yes and no, both ways. But it's time for a break. We'll go for a break, and once I come back, I'll again repeat this question because he wants something more specific. And there's another question regarding vitamin D. It is said that now, especially during the COVID-19 crisis, people are being asked to consume more of vitamin D. How can that be helpful, and how can it strengthen our immune system? So we'll talk all about this after this short break.
ਭਾਰਤ ਪੈਸੇ ਭੇਜਣੇ ਹੋਣ ਜਾਂ ਫਿਰ ਮੰਗਵਾਉਣੇ ਹੋਣ ਤੇ ਯਾਦ ਰੱਖੋ ਪੰਜਾਬ ਫੋਰੈਕਸ ਨੂੰ ਤਸੱਲੀਬਖਸ਼ ਸੇਵਾਵਾਂ ਅਤੇ ਵਧੀਆ ਰੇਟ ਦੇਣ ਦੀ ਇਹ ਗਾਰੰਟੀ ਕਰਦੇ ਹਨ। ਅੱਜ ਹੀ ਕਾਲ ਕਰੋ 6043491313 ਉੱਤੇ।
ਲੈਣਾ ਚਾਹੁੰਦੇ ਹੋ ਨਵੇਂ ਤੇ ਵਧੀਆ ਅਪਲਾਈਐਂਸਸ ਜਿਵੇਂ ਕਿ ਸਟੋਵ, ਓਵਨ, ਫ੍ਰਿਜ, ਵਾਸ਼ਰ ਡਰਾਇਰ, ਮਾਈਕ੍ਰੋਵੇਵ, ਫ੍ਰੀਜ਼ਰਸ ਜਾਂ ਡਿਸ਼ਵਾਸ਼ਰ, ਤਾਂ ਫਿਰ ਪਹੁੰਚੋ ਪ੍ਰੀਮੀਅਮ ਅਪਲਾਈਐਂਸਸ ਤੇ। ਇਹਨਾਂ ਦੀਆਂ 3 ਬ੍ਰਾਂਚਸ ਸਰੀ, ਐਬਟਸਫੋਰਡ ਤੇ ਚਿਲਵੈਕ ਵਿੱਚ ਹਨ। ਇੱਥੇ ਤੁਹਾਨੂੰ ਵਾਜਬ ਕੀਮਤਾਂ ਤੇ ਅਪਲਾਈਐਂਸਸ ਮਿਲਣਗੇ। ਇਹ ਡਿਲੀਵਰੀ ਤੇ ਇੰਸਟਾਲੇਸ਼ਨ ਵੀ ਕਰਦੇ ਹਨ। ਸਪੈਸ਼ਲ ਪੈਕੇजेस ਫॉर ਬਿਲਡਰਸ ਐਂਡ ਹੋਮ ਓਨਰਸ। ਕਾਲ 6045904140 604 590 4140। ਵੈਨਕਾਸਾ ਟਾਈਲ ਅਤੇ ਸਟੋਨ ਸ਼ੋਰੂਮ ਇੱਕ ਐਸੀ ਥਾਂ ਹੈ ਜਿੱਥੇ ਤੁਹਾਨੂੰ ਹੋਲਸੇਲ ਕੀਮਤਾਂ ਤੇ ਹਰ ਕਿਸਮ ਦੀਆਂ ਟਾਈਲਸ, ਸਟੋਨ, ਮਾਰਬਲ, ਬੈਕਸਪਲੈਸ਼, ਮੋਜ਼ੇਕ ਆਦਿ ਵਾਜਬ ਕੀਮਤਾਂ ਤੇ ਮਿਲ ਸਕਦਾ ਹੈ। ਇਟਾਲੀਅਨ, ਸਪੈਨਿਸ਼, ਚਾਈਨੀਜ਼ ਪੋਰਸਲਨ ਜਾਂ ਸਿਰੈਮਿਕ ਟਾਈਲਸ ਜਾਂ ਮਾਰਬਲ ਸਪੈਸ਼ਲ ਆਰਡਰ ਤੇ ਜਾਂ ਕਲੀਅਰੈਂਸ ਤੇ ਲੈ ਸਕਦੇ ਹੋ। ਮਾਲਕ ਡਾਇਰੈਕਟ ਟਾਈਲਸ ਇੰਪੋਰਟ ਕਰਦੇ ਹਨ, ਜਿਸ ਕਰਕੇ ਵਧੀਆ ਕੁਆਲਿਟੀ ਦਾ ਸਮਾਨ ਤੁਸੀਂ ਆਪਣੇ ਘਰ ਦਾ ਸ਼ਿੰਗਾਰ ਬਣਾ ਸਕਦੇ ਹੋ। ਅੱਜ ਹੀ ਵਿਜ਼ਿਟ ਕਰੋ 1304 84 ਐਵਨਿਊ ਸਰੀ। ਪੰਜਾਬੀ ਹਿੰਦੀ ਵਿੱਚ ਗੱਲ ਕਰਨ ਲਈ ਕਾਲ ਕਰੋ 604 330 7363 604 330 7363। Once again, welcome back to the program. I'm your host Harpreet Singh, and today we are talking to Alan Glasser, who is a well-known pharmacist. He has over 40 years of experience as a pharmacist, and also he teaches at the UBC also. So today we are talking to him as to people who have compromised immune system, what they should know during this COVID-19 crisis, and especially how COVID-19 can impact them. So we'll get him back on air shortly, but before that I would like to tell our supporters with whose support this program is brought to you daily, Monday to Friday at 7 p.m. Pacific Standard Time. AMC Insurance is one of our supporters. If you're looking for home, auto, travel, business, life or recreational insurance, they can help you out. They have 9 offices to serve you in Lower Mainland, and they're open from 8:30 a.m. onwards till 9 p.m. 7 days a week. Phone number is 604-507-6666. Our next sponsor is Ahi Transportation Group. They have been in the storage and transportation industry since 1993, and their motto is "Your cargo is our responsibility." So if you are planning to send any of your products anywhere in Canada, you can depend upon them. Call them at 604-940-9511. Address is 8970 River Road, Delta. ਅੱਜ ਦਾ ਇਹ ਪ੍ਰੋਗਰਾਮ ਤੁਹਾਡੇ ਤੱਕ ਪਹੁੰਚਾਇਆ ਜਾ ਰਿਹਾ ਅਮਨ ਟਾਈਲਸ ਦੇ ਸਹਿਯੋਗ ਨਾਲ। ਨਵਾਂ ਘਰ ਬਣਾ ਰਹੇ ਹੋ ਜਾਂ ਪੁਰਾਣੇ ਘਰ ਨੂੰ ਰੈਨੋਵੇਟ ਕਰਨ ਦੀ ਸੋਚ ਰਹੇ ਹੋ, ਪਤਾ ਨਹੀਂ ਚੱਲ ਰਿਹਾ ਕਿ ਟਾਈਲਸ ਕਿਹਦੇ ਕੋਲੋਂ ਲਵਾਈਆਂ ਜਾਣ, ਤੁਹਾਡੀ ਦੌੜ ਖਤਮ ਹੁੰਦੀ ਹੈ ਅਮਨ ਟਾਈਲਸ ਕੋਲ ਪਹੁੰਚ ਕੇ। ਗ੍ਰੇਨਾਈਟ, ਮਾਰਬਲ, ਪੋਰਸਲਨ, ਸਿਰੈਮਿਕ ਟਾਈਲਸ, ਕਿਚਨ, ਬਾਥ, ਸ਼ਲੂਟਰ ਤੇ ਕਸਟਮ ਸ਼ਾਰ ਬੇਸ, फायरप्लेसिस, डेक्स ਤੇ ਦੀਵਾਰਾਂ ਤੇ ਟਾਈਲਸ ਲਾਉਣ ਦੀ ਮਹਾਰਤ ਰੱਖਦੇ ਹਨ। 778-316-3510 778-316-3510 ਤੇ ਇਹਨਾਂ ਨੂੰ ਫੋਨ ਕਰ ਸਕਦੇ ਹੋ ਤੇ ਹਰ ਬਜਟ ਦਾ ਇਹ ਕੰਮ ਕਰਦੇ ਨੇ। ਪ੍ਰੋਗਰਾਮ ਤੁਹਾਡੇ ਤੱਕ ਪਹੁੰਚਾਇਆ ਜਾ ਰਿਹਾ ਬੈਸਟ ਹੋਮ ਕਿਚਨ ਕੈਬਨਿਟਸ ਦੇ ਸਹਿਯੋਗ ਦੇ ਨਾਲ। ਘਰ ਦੀ ਸ਼ਾਨ ਹੁੰਦੀ ਹੈ ਕਿਚਨ, ਤੇ ਇਸ ਨੂੰ ਸੋਹਣਾ ਬਣਾਉਣ ਵਿੱਚ ਬੈਸਟ ਹੋਮ ਕਿਚਨ ਕੈਬਨਿਟਸ ਲੋਅਰ ਮੇਨਲੈਂਡ ਵਿੱਚ ਇੱਕ ਜਾਣੀ ਪਛਾਣੀ ਕੰਪਨੀ ਹਨ। ਕਸਟਮ ਹਾਈ ਐਂਡ ਘਰਾਂ ਤੋਂ ਲੈ ਕੇ ਮਲਟੀ ਯੂਨਿਟ ਪ੍ਰੋਜੈਕਟਸ ਇਹ ਕਰਦੇ ਨੇ। ਹਰ ਤਰ੍ਹਾਂ ਦਾ ਸਪੈਸ਼ਲ ਕੈਬਨਿਟ ਦਾ ਕੰਮ ਕਰਾਉਣ ਲਈ ਬੈਸਟ ਹੋਮ ਕਿਚਨ ਕੈਬਨਿਟਸ ਨੂੰ ਯਾਦ ਰੱਖੋ। ਕਾਲ ਕਰੋ ਸੁਰਜੀਤ ਢੇਸੀ ਨੂੰ 604-591-8171 604-591-8171. So let's once again bring Alan back to the program, and I'm receiving a lot of messages from people on different questions, so we'll continue with the discussion. So before the break, Alan, the question was people who have already the inflammation in their bodies, how COVID can further impact them.
So we mentioned about COVID. So inflammation can lead to, unfortunately, blood clots. Mm-hmm. Okay, that's another big concern with COVID. And you also mentioned vitamin D. So what can we do to help reduce our risk of inflammation in our bodies? Up to 4,000 to 5,000 units of vitamin D a day can make a huge difference. Yeah, vitamin D specifically helps with inflammation. It helps with the cellular growth, helps with your immune system. It's a tremendous benefit. We call it the sunshine vitamin, because when there's sun, in just 10 or 20 minutes, you can make 30,000 units of vitamin D on your skin. Mm-hmm. But of course, in the wintertime, you need to take some. So I'd recommend, the government of Canada recommends up to 4,000 units a day. And I've seen from other sources, you can take 5,000 units safely too. So one, taking extra vitamin D will address this inflammatory problem. Taking extra vitamin D then is going to help reduce your risk of these clots. Also, we said there's a whole slew of other antioxidants that is something that's measurable. Because you can measure your vitamin D, but you have to go through your doctor, get a blood test. It may or may not be part of the free panel. You may have to spend $20 or $30 to find out. But you can find out if you're safe.
Okay.
Now,
what else needs to be done to strengthen your immune system?
So, to strengthen your immune system, the key thing is you need high amount of antioxidants. And I mentioned before, what's an antioxidant? If you can imagine an atom, it's full of electrons. You got the middle of the atom, and then you got the electrons floating around it. when your atom loses an electron and doesn't go looking for it, that's called an antioxidant. It can give up an electron and not look for it. That's what you want more of your body, because what's causing the inflammation is another atom. It doesn't have enough electrons and it wants to suck another one up from the inside of your cell. That can do your cell harm, and that will cause inflammation, which eventually leads to trigger cell death, and it opens up and fluids come out. And that's when people have a problem in their lungs, when these fluids come out from these broken cells. That's what inflammation, too severe inflammation can happen.
Okay.
So,
Alan, I have a question from Abhay, and he is a university-going student, and he says, it seems that we are losing the battle with COVID-19 for the time being, but till the time the vaccine comes out, you have told quite a few things. But what is the most important thing, as you also have been dealing with patients? A lot of patients come to your clinic also, to your pharmacy. So what would be the most important recommendation during this COVID crisis which people should follow?
Well, number one, you wear a mask. Number two, you have some kind of eye protection. Some people have a clear mask they go over their face. And number three is wash your hands. Those are the simple things, or use a hand sanitizer, and avoid touching anywhere on your face until you've sanitized your hands. Those are the simple things that we can do to help ourselves.
Right. Now, when you talk about hand sanitizers also, that's another issue, when you are in the market, or right now you have flooded with different kinds of hand sanitizers. Would you recommend something on this ground also as to what kind of hand sanitizer should be taken? Because for a common person, you just pay and you just get something. Sometimes it's too greasy or sometimes it's too oily. What kind of hand sanitizer would you recommend?
So we know what kills viruses. The best level of alcohol, and that's ethyl alcohol or isopropyl alcohol, is 70%. And the other 30% is water. That combination, and we've known for literally centuries, is very effective when it comes in contact with bacteria and viruses, and it helps kill them. Okay? The other thing is, you'll see on the label benzalkonium chloride, a very low percentage. That's another very effective antiviral agent that will help kill this virus. So that I always look for on a hand sanitizer, and that's what I do carry at Mark's Pharmacy, 80th and Scott Road in Delta.
Kuljeet Kaur has sent a question, and she says her mother is diabetic. She's 75 years old. What would you recommend for her as to how to save her from COVID? Of course, you've talked about to wear masks, to regularly wash your hands, but especially she's diabetic. Any recommendations for her?
So if she's diabetic, the key is you want to maintain her blood sugar as best you can in the normal levels. And people now have the ability to test. They just prick their finger and they ensure that, number one, the level stays below 10, and number two, over 3 months, that they're below 10% of their age. So if your mom's 65, hopefully her A1C, which is the 3-month level of blood sugar, is below 7.5 or below. And we know that when we drive sugar levels too low, blood glucose levels too low in the body, it actually shortens a person's life with drugs. But you can monitor the blood sugar and keep it definitely below 10 when you randomly check, and definitely below 7.5 or below when they do the 3-month testing. And that's by avoiding sugar, avoiding starches, right? Reducing it even slightly to maintain low blood sugar levels, or normal.
Okay. Towards the end, there are a lot of questions. I will not be able to take all the questions, but definitely you can call directly to Mr. Alan Glasser at Mark's Pharmacy. I'll give you the number at the end also. In conclusion, keeping the COVID-19 crisis in mind, what would you like to sum up today, Alan, as to the discussion what we have had?
Well, in terms of best protect yourself personally, you need your best nutrition, and we test for that at Mark's Pharmacy, 80th Scott Road in Delta. Second thing is to protect yourself from getting infected. Maintain your social distance, absolutely. Wear the mask, and wash your hands or sanitize your hands regularly before you touch your food or before you touch your face.
Great. Thank you, Alan, for sparing your time and being with us in this monthly talk, what we have with our viewers. Thank you very much. And we hope our viewers today have learned a lot as far as nutrition is concerned, and especially during the COVID-19 crisis, people who have compromised immune system, what they should know and what they should do. So anybody whose question I have not been able to take, you can call Alan at 604-596-1774. And as a special gesture, he is going to give a special prize also to anyone who goes to his pharmacy. This is what he has promised me before the program started. So you can call him at 604-596-1774. And if by any chance he doesn't fulfill his promise, you can call us back so that next time we can make him accountable. Alan, thank you very much for your time.
Thank you, Harpreet.
Thank you. Have a good evening. Thank you. ਸੋ ਇਹ ਸਨ ਐਲਨ ਗਲੈਸਰ, ਜਿਹੜੇ ਕਿ ਇੱਕ ਫਾਰਮਾਸਿਸਟ ਨੇ, ਤੇ ਇਹਨਾਂ ਨੇ ਦੱਸਿਆ ਕਿ ਕੋਵਿਡ-19 ਦੇ ਦੌਰਾਨ ਉਹ ਲੋਕ ਜਿਨ੍ਹਾਂ ਦਾ ਇਮਿਊਨ ਸਿਸਟਮ ਬਹੁਤਾ ਠੀਕ ਨਹੀਂ ਹੈਗਾ, ਉਹਨਾਂ ਨੂੰ ਕਿਹੜੀ ਚੀਜ਼ਾਂ ਦਾ ਧਿਆਨ ਰੱਖਣ ਦੀ ਲੋੜ ਹੈ। ਇਸ ਸਮੇਂ ਕੋਵਿਡ-19 ਜਿਸ ਤਰ੍ਹਾਂ ਫੈਲ ਰਿਹਾ ਹੈ, ਸੈਕੰਡ ਵੇਵ ਦੁਬਾਰਾ ਕਹੀ ਜਾ ਰਹੀ ਹੈ ਕਿ ਆ ਰਹੀ ਹੈ, ਸਾਡਾ ਸਾਰਿਆਂ ਦਾ ਫਰਜ਼ ਬਣਦਾ ਹੈ ਕਿ ਬੇਸਿਕ ਜਿਹੜੀ ਚੀਜ਼ਾਂ ਸਾਨੂੰ ਦੱਸੀਆਂ ਜਾਂਦੀਆਂ ਨੇ ਕਿ ਮਾਸਕ ਪਾ ਕੇ ਰੱਖੀਏ, ਸੋਸ਼ਲ ਡਿਸਟੈਂਸਿੰਗ ਤੇ ਹੱਥ ਚੰਗੀ ਤਰੀਕੇ ਨਾਲ ਧੋਈਏ, ਇਹ ਚੀਜ਼ਾਂ ਤਾਂ ਜ਼ਰੂਰ ਫੋਲੋ ਕਰੀਏ, ਪਰ ਉਸ ਦੇ ਨਾਲ ਆਪਣੇ ਇਮਿਊਨ ਸਿਸਟਮ ਨੂੰ ਸਟਰੋਂਗ ਬਣਾਉਣ ਵਾਸਤੇ ਚੰਗੇ ਐਂਟੀਆਕਸੀਡੈਂਟਸ, ਚੰਗੇ ਸਪਲੀਮੈਂਟਸ ਜਿਹੜੇ ਹੈਗੇ ਨੇ ਉਹ ਜ਼ਰੂਰ ਲਈਏ, ਤੇ ਨਾਲ ਪੌਸ਼ਟਿਕ ਖਾਣਾ ਜਿਹੜਾ ਉਹ ਜ਼ਰੂਰ ਲਈਏ, ਜਿਸ ਨਾਲ ਕਿ ਅਸੀਂ ਆਪਣੇ ਆਪ ਨੂੰ ਤੰਦਰੁਸਤ ਰੱਖ ਸਕਨੇ ਹਾਂ ਤੇ ਇਸ ਬਿਮਾਰੀ ਦਾ ਇਲਾਜ ਜੋ ਹੈ ਇਸ ਨਾਲ ਡਟ ਕੇ ਅਸੀਂ ਲੜ ਸਕਦੇ ਹਾਂ। ਥੋੜਾ ਮੇਰਾ ਸਾਥ ਹੋਇਆ ਕਰਦਾ ਹੈ ਮੰਡੇ ਟੂ ਫਰਾਈਡੇ ਸ਼ਾਮ ਦੇ 7 ਵਜੇ ਪੈਸੀਫਿਕ ਸਟੈਂਡਰਡ ਟਾਈਮ ਦੇ ਮੁਤਾਬਿਕ। ਤੁਸੀਂ ਵੀ ਇਸ ਪ੍ਰੋਗਰਾਮ ਦਾ ਹਿੱਸਾ ਬਣਨਾ ਚਾਹੋ ਜਾਂ ਕਿਸੇ ਨੂੰ ਜਾਣਦੇ ਹੋ ਜਿਹੜਾ ਆ ਕੇ ਕੁਝ ਇਨਫੋਰਮੇਸ਼ਨ ਦੇ ਸਕੇ, ਕਿਉਂਕਿ ਇਸ ਪ੍ਰੋਗਰਾਮ ਦਾ ਮਕਸਦ ਹੈ ਤੁਹਾਨੂੰ ਐਜੂਕੇਟ ਕਰਨਾ, ਇੰਸਪਾਇਰ ਕਰਨਾ, ताकि ਅਸੀਂ ਇੰਪਾਰਟ ਹੋ ਸਕੀਏ। तो इसी करके मंडे टू फ्राइडे शाम के 7 वजे पैसीफिक स्टैंडर्ड टाइम थोड़ा मेरा साथ होया करता है। तो इत्थे करते हैं प्रोग्राम की समाप्ति। मेरे नाल संपर्क करने 604-603-7555, 604-603-7555 या फिर ईमेल जरिए संपर्क कर सकते हो harpreetsingh@gmail.com। Thanks for sparing your time and watching this program. You can call us anytime। इत्थे लेना आ गया, फिर मुलाकात करेंगे। Have a safe evening and enjoy yourself।
ਜੇ ਕਿਸੇ ਬਿਜ਼ਨਸਮੈਨ ਨੂੰ ਕੋਈ ਪਿਆਰ ਕਰਦਾ ਹੈ ਤਾਂ ਕੀ ਵਜ੍ਹਾ ਹੋ ਸਕਦੀ ਹੈ? ਸੁਖੀ ਬਾਟ ਮੋਟਰਸ ਦੇ ਓਨਰ ਸੁਖੀ ਬਾਟ ਨੂੰ ਵੇਖ ਕੇ ਇਹ ਗੱਲ ਸਮਝ ਆ ਜਾਂਦੀ ਹੈ। ਇੰਟੈਲੀਜੈਂਸ ਦਾ ਉਦਾਹਰਨ ਇਹ ਹੈ ਕਿ ਕਾਰ ਸੈਗਮੈਂਟ ਤੋਂ ਵੱਖ ਸੁਖੀ ਬਾਟ ਮੋਟਰਸ ਲੈ ਕੇ ਆਏ ਨੇ ਸਰੀ ਦਾ ਪਹਿਲਾ ਟਰੱਕ ਸੈਂਟਰ, ਜਿੱਥੇ ਤੁਹਾਡੇ ਲੋੜ ਦੇ ਹਿਸਾਬ ਨਾਲ ਤੁਹਾਨੂੰ ਲੋੜੀਂਦੇ ਟਰੱਕਸ ਬਾਰੇ ਗਾਈਡੈਂਸ ਦਿੱਤੀ ਜਾਂਦੀ ਹੈ। ਸਪੇਸ, ਮੋਡੀਫਿਕੇਸ਼ਨ ਤੇ ਫਿਊਲ ਐਫੀਸ਼ੀਐਂਸੀ ਸਭ ਨੂੰ ਧਿਆਨ ਵਿੱਚ ਰੱਖਿਆ ਜਾਂਦਾ ਹੈ। ਸੁਖੀ ਬਾਟ ਟਰੱਕ ਸੈਂਟਰ, ਇਹਨਾਂ ਟਰੱਕਾਂ ਨਾਲ ਹੀ ਹੈ ਟੌਰ।
ਘਰ ਇੱਕ ਐਸੀ ਥਾਂ ਹੁੰਦੀ ਹੈ ਜਿੱਥੇ ਹਰ ਕੋਈ ਆਪਣੀ ਨਿੱਜੀ ਜ਼ਿੰਦਗੀ ਦੇ ਸੁਨਹਿਰੀ ਪਲ ਯਾਦ ਰੱਖਦਾ ਹੈ। ਉਹ ਜਗ੍ਹਾ ਜਿੱਥੇ ਉਹ ਰਹਿੰਦਾ ਹੈ ਤੇ ਪਿਆਰ ਭਰਿਆ ਜੀਵਨ ਬਤੀਤ ਕਰਦਾ ਹੈ। ਇਹ ਗੱਲਾਂ ਤਾਂ ਹੀ ਪੂਰੀਆਂ ਹੁੰਦੀਆਂ ਨੇ ਜਦ ਕਿਸੇ ਜਗ੍ਹਾ ਨੂੰ ਸਜੇ ਹੋਏ ਘਰ 'ਚ ਬਦਲਿਆ ਜਾਵੇ। ਨਵੇਂ ਘਰਾਂ ਨੂੰ ਫਰੇਮਿੰਗ ਤੋਂ ਲੈ ਕੇ ਫਿਨਿਸ਼ਿੰਗ ਤੱਕ, ਡ੍ਰੇਪਰੀ, ਪੇਂਟਿੰਗਸ ਤੋਂ ਲੈ ਕੇ ਡੈਕੋਰੇਸ਼ਨ ਅਸੈਸਰੀਜ਼ ਤੱਕ, ਤੁਸੀਂ SK ਹੋਮ ਡਿਜ਼ਾਈਨਸ ਦੀਆਂ ਪ੍ਰੋਫੈਸ਼ਨਲ ਸਰਵਿਸਿਜ਼ ਲੈ ਕੇ ਆਪਣੇ ਸੁਪਨਿਆਂ ਦੇ ਘਰ ਨੂੰ ਹਕੀਕਤ 'ਚ ਬਦਲ ਸਕਦੇ ਹੋ। ਕੰਟੈਕਟ ਕਰੋ ਸੰਦੀਪ ਕੌਰ 6048259295।
ਸ਼ਾਈਨ ਫੈਮਿਲੀ ਡੈਂਟਲ ਕਲੀਨਿਕ ਡਾਕਟਰ ਸਤਪ੍ਰੀਤ ਸਿੰਘ ਦੀ ਦੇਖਰੇਖ ਹੇਠ ਆਧੁਨਿਕ ਮਸ਼ੀਨਾਂ ਦੀ ਵਰਤੋਂ ਨਾਲ ਤੁਹਾਡੇ ਦੰਦਾਂ ਦੀ ਸਹੀ ਕੇਅਰ ਕਰਦੇ ਹਨ। ਇਹਨਾਂ ਦੀ ਸੇਵਾਵਾਂ ਵਿੱਚ ਦੰਦਾਂ ਨੂੰ ਸਾਫ਼ ਕਰਨਾ, ਕਰਾਊਨਸ, ਬ੍ਰਿਜਸ, ਡੈਂਟਲ ਇੰਪਲਾਂਟਸ, ਰੂਟ ਕਨਾਲ, ਡੈਂਚਰਸ, ਬੌਂਡਿੰਗ ਅਤੇ ਵਨੀਰਸ, ਐਕਸਟ੍ਰੈਕਸ਼ਨਸ, ਬੋਨ ਕ੍ਰੈਫਟਿੰਗ ਆਦਿ ਸ਼ਾਮਲ ਹਨ। ਬੱਚਿਆਂ ਦੀ ਡੈਂਟਿਸਟਰੀ ਦੇ ਵੀ ਮਾਹਰ ਹਨ। ਇਹ ਇੰਸ਼ੋਰੈਂਸ ਕੰਪਨੀਆਂ ਨੂੰ ਡਾਇਰੈਕਟਲੀ ਬਿੱਲ ਭੇਜਦੇ ਹਨ ਤੇ ਤੁਹਾਨੂੰ ਘੱਟ ਤੋਂ ਘੱਟ ਚਾਰਜ ਕਰਨ ਦਾ ਵਾਅਦਾ ਕਰਦੇ ਹਨ। ਫॉर स्पेशल शाइन एंड स्माइल 604-503-0320 ਤੇ ਕਾਲ ਕਰੋ। ਕਿੰਗ ਜਾਰਜ ਸੁਪਰ ਸਟੋਰ ਦੇ ਕੋਲ, ਯੂਨਿਟ 370, 7488 ਕਿੰਗ ਜਾਰਜ ਬੁਲੇਵਾਰਡ, ਸਰੀ।
ਕੁਦਰਤ ਦੇ ਸੌਮਿਆਂ ਦੀ ਵਰਤੋਂ ਆਯੁਰਵੇਦਾ ਰਾਹੀਂ 5000 ਸਾਲਾਂ ਤੋਂ ਚੱਲਦੀ ਆ ਰਹੀ ਹੈ ਤੇ ਹੁਣ ਕੈਨੇਡਾ ਵਿੱਚ ਹੀ ਬਣਾਏ ਗਏ ਹੈਲਥ ਕੈਨੇਡਾ ਵੱਲੋਂ ਅਪਰੂਵਡ 100% ਸ਼ੁੱਧ ਆਯੁਰਵੈਦਿਕ ਡਾਇਟਰੀ ਸਪਲੀਮੈਂਟਸ ਦਾ ਲਾਭ ਲੈ ਸਕਦੇ ਹੋ। ਸਟ੍ਰੈਸ, ਐਂਗਜ਼ਾਇਟੀ, ਇਨਸੋਮਨੀਆ, ਬਲੱਡ ਸ਼ੂਗਰ, ਕਿਡਨੀ, ਬਲੈਡਰ, ਹਾਜ਼ਮਾ, ਆਈਸਾਈਟ ਜਾਂ ਕਿਸੇ ਵੀ ਕਿਸਮ ਦੀ ਬਿਮਾਰੀ ਦਾ ਆਰਗੈਨਿਕ ਇਲਾਜ, ਜੋੜਾਂ ਦੀਆਂ ਦਰਦਾਂ ਤੇ ਸਰੀਰਕ ਮਸਾਜ ਲਈ ਕਈ ਕਿਸਮ ਦੇ ਆਯੁਰਵੈਦਿਕ ਤੇਲ ਵੀ ਉਪਲਬਧ ਹਨ। ਹੋਲਸੇਲ ਕੀਮਤਾਂ ਲਈ ਕਾਲ 604-628-2003।